Okay. Good afternoon, everyone. Thanks for joining us today for a Studio X Drop-In Friday. So these are informal talks and workshops and demos all about XR, and we have them every Friday at 1 p.m. So we're super excited today because we have Riham Alieldin joining us to talk about her work with VR as a training tool for empathy for med students. So I'm just gonna, hold on a second, there we go. And then just a brief intro. Dr. Alieldin is a physician and medical educator whose expertise lies in teaching and designing curricula for health professionals. She was involved in the educational reform process of her medical school by implementing new medical curricula, providing professional development opportunities to the medical faculty, and working with her school's accreditation teams. She is currently an adjunct faculty at the Warner School of Education and enjoys teaching graduate students in the Master's in Health Professionals Education degree program. Dr. Alieldin obtained her master's degree in Health Professionals Education at the Warner School of Education at the University of Rochester in 2015 and is currently a PhD candidate at the same university. Her research focuses on the evaluation of the transfer and acquisition of knowledge, attitudes, or skills in medical education to produce physicians who are prepared to serve the fundamental purposes of medicine and patient care. Dr. Alieldin is keen on providing relevant, meaningful, and interactive learning experiences to her students, as she believes that providing a safe and efficient healthcare service to our community starts by building a sound educational system for its health professionals. So with that, I'll go ahead and turn it over to Riham, and yeah, thank you.
So thank you for having me, and it's a pleasure being with you today. And thank you for everybody who's attending my talk. And today, I just wanted to talk a little bit about some of the research and a project that I'm doing at the Medical Center, specifically the School of Medicine and Dentistry at the University of Rochester, using virtual reality for teaching medical students. And as Megan said, I'm a physician and a medical educator, and I've been always interested in teaching medical students and health professionals and looking into all the types of teaching strategies for providing those learning experiences. Medical simulation has actually been something that I've been researching and studying for several years. And a few years ago, I stumbled across VR, virtual reality, and I was really impressed with the technology and its potentials in learning, teaching, and education, and just looking into how it can be used in the medical field for healthcare and education. And sadly, it's VR still, the research in VR specifically in the medical field is still at its infancy, and there isn't a lot of research out there yet to explore the technology. So, and this is how my research interests evolved, and today I'm gonna be talking about using virtual reality specifically for empathy training for medical students. And empathy, it's just different than clinical skills. It's not, a step-by-step process that you can teach to students. It's more like an emotional response and an internal process that they need to go through. And it was interesting to see how the immersive experience that something like VR can provide can help in teaching something like empathy and empathetic communication to our students. But before I go and dive into the research itself, I wanted to talk a little bit about some of the terms in VR, some general idea on how virtual reality has been used so far in medical education and health professionals education. And actually, VR was there 50 years or more, maybe like 60 years ago, way before VR was cool, like right now. So as you can see on this left picture, so this is Hugo Gernsback. He's wearing he invented something called teleglasses. And it has the same concept of VR, of having a picture being so projected very near or very close to your eyes and being immersed in the experience. And he was an American inventor and a writer, and he has a lot of publication in science fiction that they call him the father of science fiction. And on the left picture, this is on the right picture, I mean, it's in 1968 from, so Evan Sutherland, they invented this very scary headset, large, that's just dangling from the ceiling. And they actually called it the Sword of Damocles for the way it looks. And it's just, hanging from the ceiling. You have to put like this enormous I would call it a headset on your face and head, and it's attached to a computer. But luckily, in 2021, we don't have to go through this anymore. We have all these different types of headsets that are more convenient, lightweight, and more available for us to use. Like you see here, we have those that are attached to a laptop, like the HTC Vive. You have portable options like HoloLens and Oculus Quest. So we have come a long way from where it was 50 or 60 years ago. So virtual reality is the use of computer technology to create this simulated environment where it places the user inside this virtual experience. And as you see here in the picture, so there is VR, virtual reality, AR, augmented reality, and MR, mixed reality. And these are all technologies that are used as immersive technologies. But look at them like as a continuum that can be used to describe the transition from real to virtual environment, depending on the extent of the sense of immersions that the user have moving along this continuum. So for example, VR, which is involved, like putting on the headset, you are completely isolated from the physical world by being fully immersed in a virtual environment that simulates real life. While the second picture, the AR, we are superimposing a virtual information and objects on the physical world. So you are still maintaining your awareness of the real world around you. You just have virtual objects, superimposed in this environment. Mixed reality is like AR, but it has the interactivity piece where physical and virtual worlds coexist, and users can manipulate these environments and interact with both real and virtual objects. Something like the HoloLens and what it offers. XR is the extended reality, and hence I think the name Studio X is an umbrella term that covers VR and AR and MR. So VR, as I said, the headsets being isolated, AR similar to, or augmented reality similar to the apps that you have on your phone. Like this one up here is the IKEA app where you can place furniture and see how it looks. This is the famous Pokemon game. I don't know if anybody's familiar with it, but it was a hit, I think, a couple of years ago, looking for Pokemons everywhere. Mixed reality is something like the HoloLens. Like you see in this picture, surgeons, they are aware that they are in the operation room. They can see the people around them. They can see the patient. But at the same time, with the HoloLens, wearing the HoloLens, they can also superimpose this image or picture scan of the patient or seeing like vessels and nerves and just manipulating it. So, and this is what mixed reality is. So what makes virtual reality a powerful tool for learning? It allows learner to feel the sensory illusion of being present in another environment by removing the screen interface similar to the one that we have now with our laptops. So it allows them to learn from experience as they would in real life. And it's subjective. So as you can see, immersion, presence, and real-time interactivity are one of the main characteristics and unique features of VR, where it offers this subjective mental and sensory perception of isolation from the real world. Learning on demand. So something like Studio X, or just having the facility, the resources, and the equipment. And once you have it there and you have the appropriate software, learners can, just go in whenever they want, schedule a time, and just go do a whole learning experience, even on patients, or do a surgery. And we will look into some of these applications later on with some of the slides. But just think about having learning on demand available for students anytime. Repetition in a safe and learning environment. And this is something really important in medical education specifically, because we're dealing with human lives. So you need to feel safe learning. You're not doing like fatal mistakes and causing the complications or even the life of your patient. So just having a resource or a technology that allows you to practice a skill or clinical decision making, and it's safe for you to have to do errors, make mistakes, and repeat and learn from your mistakes. Imagination and creativity, of course, is also one of its features, because it's basically, you have the equipment, but basically you're developing a software. So whatever experience you want to provide, whatever your imagination and creativity tells you, you can, of course, provided you have the money to do so, which is always important to have. But if you have the resources, you can just develop whatever experience that you want for your learners and students. So why now? Why VR in health profession education? Why is it picking up the pace? Medical education is changing at a relentless pace. With the complex needs of the aging population, the range of treatment options available, the interprofessional nature of care, and the complexity of the healthcare system, it's just no longer a question of whether an individual can retain or access facts, but it's about how our learners can use them, evaluate them, and how we can apply them to patient care. And therefore, how we prepare future clinicians for practice has had to adapt to this. So there's a move to replace traditional learning with a more clinically relevant and practical teaching. And simulation in particular has gained momentum as a method of delivering experiential learning, where your learners are actually experiencing a certain scenario or experiencing a certain skill, are able to do it rather than reading about it in a textbook or just following a steps in a video. But simulation is expensive. Imagine the number of mannequins and models that you need to have, the space that's needed. Just buying the equipment for simulation is very expensive. So with the increasing pressure on budgets and the standardization of teaching, VR is emerging now as a new method of delivering simulation experiences in the health profession education. VR allows the flexibility of access to high quality scenarios and, as I said, on-demand existence, and this can help save the institution's time, space, and resources, with the ultimate aim of just providing a consistent, customizable, you develop the software, the learning experience that you want, and cost-efficient alternative to traditional simulation. And also, it was alarming that the WHO, the World Health Organization, estimates there's going to be a shortfall of 18 million health workers within less than 10 years, and additional 9 million shortage of nurses and midwife. And there is this chronic underinvestment in education. So it has become essential to generate teaching strategies that are focused on, that are more scalable, efficient, and high quality health professional education. And as you can see here, just move this, yeah. So this is Dale's learning pyramid. And as you can see here, it shows how students retain and information and knowledge. And if you look all the way down, simulating the real experience allows students to retain around 90% of what they say or do. And even participating in a discussion or giving a talk, something that you would have in a debriefing session, for example, and this is what I did actually with my training, allows 70% of what we say to retain this information. So it just shows you how VR as an educational tool can be helpful with learning experience and retention of knowledge. So how does the era of VR look like in medical education? And actually a large body of evidence supports VR simulation in all industries, including healthcare and education. And VR is just becoming such a powerful educational tool in the medical field because it provides defined learning objectives and its implementation is just growing worldwide. And there has been this dramatic expansion in using it in ways in which can deliver medical education using VR, especially when used with the appropriate educational software. VR in particular has been adopted across medical and nursing field. And through the following slides, we'll discuss some of the applications of VR in general in medical education and health profession education. So anatomy, physiology, and pathology are actually one of the most growing fields in medical education and health professional teaching where VR is being used and applied. And as you can see here, so let me play this video here. So this one shows you a VR application. It's called 3D Organon and it's for anatomy. And as you can see here, you put on the headset, you are fully immersed in the experience. You are in this lecture room and you can literally feel every layer of the human body. You can take notes, you can point at structures, it has labels on it. And the beauty of this is that you can have also multiple users. So you can have the facilitator or the instructor putting on the headset, the students there with their headsets as well, and just explaining this. And imagine the potential that this provides compared to just a regular anatomy lab where you are doing dissection, not able to, take sections in a certain part and just seeing how the relations of every part of the body looks like. Another app that's also taking place in anatomy and physiology is this app, and it's called ShareCare. Well, let me play this for you as well. So this app is not only about anatomy, it's physiology as well. So you can actually see how each part of each organ in your body is working. You can see the brain, the nerve, you see the heart, how the blood is flowing to the heart. And it's just very immersive, and this is something that you would not get in like a textbook or even in the anatomy laboratory. You are understanding the relations, understanding how each organ is working. And actually this video down there, this is one of our medical students, Tyler. And once we were done with our empathy training, he mentioned that in their anatomy lab, they were doing the cardiovascular system. And I told him, well, let's play with this a little bit. And he just hopped on. As you can see, he was very impressed with the circulatory system. And this is what we are seeing on the screen. But what he's seeing, he's actually inside the heart. The blood is flowing around him. He can see like the valves on the heart, opening and closing. And he had a hard time like understanding some of the physiology in the cardiovascular system. And when he used this, he said that something just clicked. So it was impressive to see some of our students go through this as well. And another very important field for using VR in health profession or medical education is clinical skills and decision making. And I don't know about you, but I would like my physician to be able to actually have skills and decide how do this, have good decision making of their treatment process. So, and it's a hard thing to teach in medicine. As I said, you need real patients, and it's not a safe environment for teaching. And I would not say that VR compares to the actual thing, like seeing a patient and bedside teaching, but at least it prepares your students for doing these skills. So when you are trying it with the patient for the first time, at least you know what you're doing, you know the steps that you need to go through. You've tried it, seen it before, tried it in your head before. So for example, this one shows how to measure blood pressure and what are the steps for doing this. These are also some videos. Let me play them through. So you can actually do an actual surgery. So like in this one, you are doing a shoulder surgery, and it walks you through the steps. It tells you which instrument you need to pick up, what other steps you need to go through. And as I said, it's missing the haptics or the touch sensation of actually using the instruments, but it does a pretty good job in you knowing the steps and being more confident in your skills.
You will need to further dissect the deep
and
using a scalpel again
this
to make a deeper incision.
This video up left, this is actually this is our VR lab at the medical center, and this is one of our students doing knee surgery
You can now see the
using one of the
fracture
applications
clearly.
we have there. And this last video, the Holo patient, this is actually a mixed reality, and I've used this, tried this using the Hololens, and it was impressive with one of the cases I used it for a COVID case. And you could see the patient. You can just literally place the patient in your living room, walk around the patient, see the signs and symptoms, how the skin is changing, see their vitals. So imagine having something like this at the tip of your fingers and having your medical students actually see a COVID patient without having, to be exposed or putting them in danger. So this is just some of the powers that virtual reality can offer for medical education. And so this is a study that was done at the Cincinnati Children's Hospital for its emergency residents. And let me play a little bit a clip of, sorry. So yeah. So as you can see here, so this is the resident up there wearing the headset. This is what he can see. He's in a room, he sees the baby or the infant, and there is like there's a facilitator facilitating the whole process and assessing his clinical decision making and the steps that the residents are taking. And it was interesting to see some of the results from this research or study. So they did surveys with the residents immediately after they were done. And as you can see here, they compared the experience to using high fidelity mannequins, which is what we use in medical simulation, or even to standardized patients. So they thought that it was as effective or as efficient as having a standardized patient. And a standardized patient is a simulated patient. So basically, it's like role play where you have people, you train people to become certain patients and they come and show some symptoms and we use it to teach our medical students. Bedside teaching, it was not as efficient. They thought it was not as effective as bedside teaching. And again, I agree with this. Of course, it's not going to be the same thing as having the actual patient, but at least it can be an adjuvant or even a replacement of simulation and standardized patient in teaching clinical decision making. So what about my research? So what I'm doing is I'm using immersive virtual reality for empathy training tool for our medical students at the University of Rochester School of Medicine and dentistry. And before I talk about my research, I want to leave you with this video for a minute or two, and then we can come back. Sorry, just a second. Okay, so so if we can see what our patients see or hear or feel what they feel, probably the answer to whether our treatment would differ, I think the answer is yes. But my question is, how can we walk in their shoes? How can we feel what they feel, and how can we see what they're seeing? So basically, what I'm looking into is, can virtual reality be the key for clinical empathy training? So empathy is the backbone of patient and physician relationship. And it's a clinical competency that entails having empathetic communication skills that are used to check, clarify, and understand and support the perceptions of patients' thoughts and feelings, and enables us to communicate this understanding, which is the basis of a physician's clinical judgment. It allows us to build relationships with our patients by diminishing these communication constraints. Given that perspective taking is a core component of empathy, and just, empathy is about being this person and emotionally feeling what this person is feeling, it's not surprising that VR experiences have been shown in literature to enhance empathy in its users by enabling them to embody another person in a virtual realistic environment and just, augment the cognitive and affective process of learner. Therefore, virtual reality has emerged as this technology that can literally allow us to walk in our patient's shoes. So my research or study, it was done at the medical center. It's the VR lab is at the miners library on the first floor of the medical school. And my study subjects were the first year medical students, and I used the embodied labs, which is the software that I use for this experience, which I will be talking a little bit some more in the following slides. And what I had them do is that they would put on the headset, they would go through a scenario where they experience social isolation and loneliness in patients, in elderly patients specifically, and just understanding some of the health outcomes and its effect on their mental and psychological well-being. The aims of this project was to explore the experiences and perceptions of medical students towards VR as a learning environment, identify the components of this new technology, which of these components that we talked about, the immersion, presence, and interactivity, and the debriefing session, which of these they found most useful, and being able to develop this a more sustainable way or educational model for teaching empathy. And of course, hopefully address some of the decay in empathy and compassion in physicians during their medical schools and residency training. This is our overarching research question. Again, does virtual reality support the development of empathy and empathetic communication of medical students? So this is the software that I use, and it's called Embodied Labs. And Embodied Labs, this is a US-based VR application platform, which creates immersive VR experiences for users to embody the perspectives and conditions of other people, basically patients, and to assume a first-person perspective of those patients. And they have a library that has, I think, like 5 or 6 medical conditions that you can embody. So they have Alzheimer's disease, Parkinson's, dementia, and all basically different diseases that take place specifically in elderly patients. They even have a really interesting one on communication with patients who have, terminal cancer and how to break this news, and just takes you through the whole experience of what this patient is suffering from, the challenges, and even how the family around this patient is reacting to what this patient is going through. And it's designed for physicians, caregivers, healthcare professionals, and students to experience just this firsthand frustration and perception of patients with illness and disabilities. It provides, as I said, it has a wide range of scenarios. And what the scenario we specifically used, the students embodied Frank, who was a 70-year-old Caucasian man. He just lost his wife, maybe a few months, and they just live Frank's attempts to navigate his new way of life. They experience this destructive impact of social isolation and understand how it can overlap with loneliness, the absence of family and relationships, like they have the kids in the scenario being absent from his life. He's trying to reach out to them. And, you just, in the scenario, just feel the frustration of Frank not being able to reach to family and get the help he needs, or getting, access to community services. I also had a debriefing session. So I did not only provide the software where they would come in, put on the headset, and just leave. We had a debriefing session, like we paused like 2 or 3 times, had them reflect on what they learned, and sort of grounded what they experienced and learned as, in them being future physicians, probably. So as a Frank's physician, what should you do? what was done wrong? How do you think this would have been done differently? So for example, Frank's gets a missed call from his physician, or like a recorded voice note saying that he needs to refill his insulin prescription. And of course, insulin is important. But you see Frank struggling to apply for healthcare, struggling to find the password for his account, struggling with technology. So as Frank's physician, what should have you done? How can you make sure that your patients are just able to get the treatment and the medication that they need? And this one, this is like a demo of the software or the specific scenario for Frank that I used. So the salesperson from Embodied Labs was kind enough to give me like a short demo. So let's play this together to give you a better idea of what the training and the students were seeing. But remember, this is 2D experience, so we are seeing it through screens. Imagine this being in a headset, and you actually, as you can see here, you will be lying in bed and doing actually those actions that Frank is doing. So let me play this video.
And Frank is basically he's alone now because his wife passed away, I think some months ago.
Yeah. So this is me and Mike talking through the demo. So, okay. And as you can see, so once you put on the headset, this is what you see, and this is your actual hand. Like we have something installed on the headset called the leap motion device, which picks up your hand motion. So like we have the students put their hands in front of them. You can, if you put your hand, you can see your hand motion.
Oh,
you
yeah.
can pick up stuff.
It's saying
pretty interactive and make decisions as you are moving.
Need more support. Well, I can take care of myself.
So here you are given like options to choose from, and it plays a different scenario each time. So like you choose picking up the phone, sending a letter, trying to go to the groceries, and all the challenges that can come with doing so. So the student is actually choosing how he wants the scenario, or she wants the scenario to move on. So we chose the phone option.
Yes. What do I do?
Dad, are you on?
I'm here.
Dad, I can't see or hear you. Can you see or hear me?
I'm here, but I don't know why you can't see me.
Dad, is your camera or your
me.
speaker on?
I would assume so.
Dad, you're gonna have to turn on your camera or your speaker for this to work.
I don't know what to do.
Look, Dad, I'm gonna have to go, okay? Why don't we connect later this week and we can talk on the phone? If you're there, okay, we'll talk later.
So as you can see, it shows you how elderly patients might have difficulty with technology. Like he's trying to connect to his daughter, and he's not able to use the technology. And these are stuff that we don't think about as physician. You're more focused on giving a prescription or a treatment, but then going beyond that and thinking about, so is my patient going to be able to get this this treatment? Does he have health insurance? Who are the people in his life who are helping him out? Do I need to connect him or her with certain services that can help provide more help to these patients? So just living the life of these patients and seeing things that are beyond their visit to the clinic, and having this be more something that we would consider, and approaching our patients with a more holistic approach for their mental and physical well-being. And these were all types of conversations that I had with my students as we were doing the debriefing after that. And these are my actual students, some of the students who came to the training. So as you can see here, they are putting on they have the headsets on, and we have the screen, and they are flipping pages in a book, looking for password in a pile of papers, making choices for community services that they can provide, and doing all these weird hand movements in the air. But I promise you, they are in there and they see what they're doing. And it's really good it allows us as facilitators or instructors doing these sessions, because I can see what they're seeing. I'm not wearing the headset, so I'm not actually immersed in the experience, but I can see what they're seeing, what choices that they make, and we can have a debriefing and a discussion, and enables me to provide more meaningful questions for them to reflect on their learning. So what I did for my study or research project, I used a mixed methods research design, where we started with them coming in, doing the Jefferson Scale of Empathy, which is a very short survey that they take, and it measures their empathy levels before the training. They would then do the VR training, go through the scenario, the whole VR experience with Frank, and then we do a debriefing session, which is also part of the training. Then we have them retake the Jefferson Scale of Empathy. And so this way we would have data, quantitative data before and after the training, and comparing whether their scores went up after the training and their empathy level actually increased. I also had a post-training semi-structured interview. And this was focused more on the technology. So I would ask them, which part of the technology you think worked for you? Do you think this is something that we should have be integrated in your medical curriculum? Were there any side effects or disadvantages that they see from this technology? So, addressing some of the questions on the technology and its efficacy in teaching empathy training. And I'm actually at this stage now. So I'm doing a follow-up interview with them within a couple of months, start to follow up on the training. So now they are doing empathy training or other training using traditional teaching methods like simulation and standardized patients and lectures. And simulation is now traditional teaching methods. It's funny to think about that, but yeah, so like other teaching methods. And then I would meet with them again and ask them, how did the VR experience compare to these other teaching methods? And we purposely chose first-year medical students because we wanted them before they are experience any other teaching methods, and so that we can have a more valid data to compare once they are going through the other teaching method and how they compare to VR. So yeah, hopefully I'll meet with them within a month or so. And finally, as I said, I'm still work in progress, and I'm still analyzing the data and transcribing my interview. But I wanted to share with you some of the feedback and quotes that I got from the students regarding the training. And actually, the feedback was 100% positive. I mean, I didn't have any student who had negative things to say about the training. They were very impressed with the technology, and a lot of them, were asking, why isn't our, in our medical curriculum now? So it was really encouraging to see these preliminary positive results from the students. And even if you see some of the quotes, one of the students said, I should call my grandma. And this again shows you the power of VR and instilling this emotional effect and in the learner, especially when you're learning something like empathy and empathetic communication. Some were even, so immersed and present in the experience that they were almost cried from, Frank had an incident where he had cardiac arrest when he was at home, and it was just so powerful. And I'm really happy with where everything is right now. So yeah, and of course there were some challenges, funding and resources. Of course, having a software like this is not free. It's not something that you can just go in and try. You have to pay for it. And I think Embodied Labs is like 6,000, maybe they're higher now for an annual subscription. But they were kind enough to give me a 1 month free trial for me to do my research. Scheduling. So what we did is we had like an open calendar where students were scheduling time and come and drop in for the training. So just making sure that you have time slots that are available for those students, having staff to direct the students to where they should go. having a secure space. You need a space where you have your equipment in a safe place, and of course having an IT staff for us to help us if we had to troubleshoot anything with the technology. Sanitization was also a concern a little bit. So what I was doing is I was wiping them with disinfectant wipes, and we had like these guards or masks that they would put on before they put on the headset. Nothing fancy like the one in Studio X with the clean box, and I think it's very wise to have something like that when you have a VR lab. But of course, this is a concern, especially with COVID. Faculty buy-in and curriculum changes, and this is where I am at now, and actually, getting faculty to just realize the potentials of VR and how, and the important affordances that it can bring into medical education in our medical school. So fingers crossed, wish me luck. And just curriculum changes. It's always difficult to change something that's already there, that's apparently working, developing just new learning objectives for our students. Yeah, and so remember, the power of virtual reality lies in its ability to create real life learning experiences that would have otherwise been difficult to achieve. So I don't think you can shadow a patient and just go home with the patient and see what they're experiencing. So it's really impressive what you can do with VR and just creating the sensory illusion of being present. And it can transform how we deliver educational experiences. And I think that our imagination is the only thing that can get in our way. And finally, I wanted to share this picture with you. So I went to Orlando, Florida on the weekend, and we did like this. This was at Universal Studio actually, and I think it was the Kong ride. And we were wearing these 3D goggles, and of course, it doesn't compare to having a headset and the immersion and presence that you get from a headset, a VR headset. But I was thinking that why learning can't be that fun, that motivation and that engaging. So we need to think about that. And this gentleman, nice man at the back, photobombed our picture, and I just told him I'll put you in my presentation, and here he is. And thank you so much for having me today, and I'm ready for any questions. And this is my email. Feel free to reach out to me, Megan or Emily, if anybody needs to follow up. I'm more than happy to talk a little bit about the research and what I'm doing. So, questions?
We have some time for questions if people want to raise their hand or unmute themselves.
Any questions?
I'll start off, I guess. Hi, Emily Sherwood. Thank you for your talk, Riham. It's nice to have you with us as always.
Thank you for having me.
I know you said that Embodied Labs had a number of scenarios that medical students could work through. Do you have any sense if there were certain scenarios that were more impactful for them or that they had like kind of more aha moments with?
So for the students who came in, we only experienced I tried all of them, but we only had time for them to do the social isolation and loneliness. I think they could all work. Again, you need to think about what you want to teach. So we tend to start with, oh, I have this cool thing that I want to try. But you need to think first, like, what are your learning objectives? So what do you want them to learn? And then think about the method for doing this. So I think, so the scenarios with the dementia and the Alzheimer's disease, I like them because they had a teaching component to it. Like they would have, like the nerve cells and how they're working. So it has like an addition of this, knowledge or information teaching piece. But again, it depends on how you are using it. What are your objectives from the training?
Riham, it's Eileen.
Eileen, go ahead.
Thank you very much. One of the questions I have is, I think about some experiences I have, whether it's in person, because I haven't had very many VR, and I think, oh yeah, that was really impactful. And the tail for how long it lasts goes down, and then in a year, I do that and I'm like, oh, that's right. I learned this and now it's just gone. What do you think, just, this is not research, but in your sense, how often might this be something good for people to work through so that we don't have that, I was empathetic and then it went in the way down?
Yeah. Yeah, and that's a problem not with empathy. It's just, learning something. If you're not reinforcing it every now and then and being exposing yourself to what's new, you just forget it. But empathy specifically, and this was actually one of the reasons why I decided to do the training on empathy, because research shows that it declines through medical school, specifically after the third year and through residency. And it's because the way it's taught, it's just, like a one-time thing, like a lecture or a video they need to watch or a survey they need to take, instead of having it be more consistent and implemented in, a lot of the steps along the way. So I would see this being, a yearly thing, or having it being implemented even as parts of just, having a patient encounter. So don't start with just, do this or do a certain clinical skills. Start from the top, start with history taking, start with, asking the right questions and counseling the patient, and having this being a more, sustainable and more consistent component of our teaching, rather than it just being something, that they need to check off a list.
Thank you.
Yeah. Any more questions?
What would be some scenarios you would like to see developed? For example, I know you said that we have ones on ageism. What are some of the other areas where you think medical students might really benefit from seeing scenarios developed?
So actually, before empathy, I was interested in diversity and equity training for health professionals and medical students. And actually, I teach a course on diversity and equity in the health profession at the Warner School of Education. And this was actually the thing that I was looking in before empathy. And the reason I'm saying this is because I feel VR can provide you those experiences, those non-touchable, or like, it's not like a skill that you teach, it plays on this sensory and emotional level. And actually, what some of the interesting feedback or data that came up from the interviews is that when I had minority students use the training, and so Frank is a Caucasian or white male. So when you put on the headset, you don't see your own hands. So if you're Black, you don't see Black hands. You still see white hands from Frank. If you are a female, you see a man's hand. And some interesting points came up of how powerful this was, how different, oh, I'm a woman and I have, white male hands, or like I'm a Black student and and of course, we all know that there are a lot of inequities in healthcare and in health education and just access to medical education in general. So I would like to see scenarios develop in this field, where the way I'm thinking of it is just, you putting on the headset, you become a different race or a different gender, and just experience some of the challenges and racism that they face. Going into a hospital and you find everything is written in English and you don't speak English. How can you navigate this system? Being an African American or a Black patient, and your pain is underestimated, and you're not given the proper treatment just because of your race. So some of these experiences, something that I would like to see. And I asked how much it would cost to develop something like that. It's like $100,000 starting, something like that. So maybe in the future when I have more money.
Got to talk to what's his name, Elon Musk. He seems to have a couple of billions laying around
Every day.
Yeah. Maybe we should do it in space then.
What I was thinking, Riham, is so my dad had a stroke like 9 years ago, and we didn't understand what he was experiencing in terms of visually, like he couldn't express it, but we knew he was seeing things that weren't there. How do you think for families as well, like maybe not this particular, but a similar software because I did a lot of research, you will not be surprised, so I had a better sense of what that might be. But
Yeah.
like, or I suppose I should ask, do you know if any of those exist now for like families of, here's what it looks like for a stroke patient?
Well, actually, the Embodied Labs has this. I wish you've told me. We could have, seen this together. Now that my free subscription is over. But the scenarios that they have shows you the struggles that the family actually goes through. So I think this was with the scenario with I think the one with dementia, and again she was seeing stuff like seeing light or seeing things floating in the air, and it shows you her son coming in, and she's seeing this and she's scared and frightened, and he trying to comfort her, but at the same time he has to go to work, so he doesn't have the time to like stay with her and make sure she's okay. He needs to go to work, and then he fights like with his wife because then she needs to stay. All of these constraints and pressure that having a patient puts on the family itself. And it was interesting to see this. It's not just focusing on the patient and what they're going through, but also seeing how this is affecting the people around you. When also the one that I like was the one with macular degeneration. So again, you have a certain field, field you can't see this part, and a doctor is giving you a form to fill in, and you just can't see it. You can't see where you should be, using your writing or making choices or whatever. And it just shows you the frustration. I kept like moving my head trying to, to avoid this defect in my field, and I couldn't. And I could feel the frustration. I can't see. I can't answer what you're asking me to. So yeah, it was powerful.
Thank you.
I promise you, if I have the subscription again, I will invite you to come in and try it.
And an interesting note to your point is that Embodied Labs was started by two sisters, and their mother, Alzheimer's patient, and so they wanted to create training and empathy tools for other family members and also the care workers.
Yeah. Yeah, she's very. I saw. I think she gave a TED talk about how everything started with her mother or grandma, and this is where the whole idea came from. She had caregivers come in, and she couldn't explain to them what her mother is going through. So this is where the whole idea came from, like having them experience what the patient is going through, so that you would understand. And again, this brings up the empathy piece, being in the shoes of your patient and just understanding the emotional pressure that they are having. Somebody is asking to get in touch with me. Emily, can you give my email to anybody who would like to? And I'm more than happy also to meet them on Zoom or anything.
Yeah, I can't make sure, but yeah, we can make sure to send it around. Or Riham, can you put it in the chat?
Yeah, I'll put it right now.
Sorry, I'm running the big television in our space, so I don't actually have the access to do that.
Yeah, no, I'm really bad with giving a presentation and following up on the chat, so I'm sorry. Yeah, here it is. So I'm more than happy to connect with anyone who would like to follow up on some of this research, and hopefully once I have more data, I can come in and give more in-depth analysis of the data, and especially the quantitative piece and what some of the numbers that have emerged from the training.
Great. Any other questions? Okay. I just want to say thank you so much, Riham, for presenting today.
Thank you for having me.
Always
a pleasure.
Just a plug for Frameless, RIT has an annual XR symposium, and Riham is also presenting at that. It's next week on Thursday and Friday, so I would put the link in the chat, but my Zoom is freaking out right now. So if you just Google Frameless RIT, you'll find all of the info. It's free and virtual and hybrid. And this talk was recorded. It'll be available later on our website if you'd like to revisit it. And yeah, thanks again, Riham, and hope everyone has a great weekend.
You too. Thank you. Thanks, everyone.
Thanks, everybody.